to detect the bias and the errors in a study. This can be done by the process of a critical appraisal. Second, understand the significance and magnitude of the results, meaning how big the difference of a specific intervention. Is it statistically significant or clinically significant? You know, when we do randomized controlled clinical trial, we have two arms. One arm will receive the intervention, and the other arm will receive the control treatment or the control intervention or the placebo. And we will expect a difference in the outcome between the two arms. So how big this difference? Is it statistically significant or just clinically significant? Third, to assess if the conclusion or knowledge from the study can be applied to the patient or patients. In other words, the applicability and generalizability of the outcome or the conclusions. Is it applicable to the patient? Can we generalize clinical guidelines from it? And the fourth one is to generate an evidence to close the gap between the research and practice. There is a huge gap between the research and clinical practice. Therefore, critical appraisal, publication like systematic reviews or clinical guidelines are very important to close this gap between the research and the practice. Sorry, I'm waiting for the PowerPoint to respond. So what are the elements of a critical appraisal? First of all, the first question, the critical appraisal process is just a matter of a question that can be asked about a specific research. And from the answer of this question, we can know the value of this research. So first of all, what is the research question? And what is the design of the study? And also, these questions ask to assess the study validity and to assess study results and assess study applicability and generalizability. So the critical appraisal process flow will start with finding a clinical problem. If we have a clinical problem in the field, for example, I will give you an example, like management of deep-seated caries. This is a clinical problem in dentistry and represent a dilemma in this field, because there are no consensus on appropriate treatment for management of deep-seated caries. For example, one dentist will choose to do partial caries removal or indirect pulp capping. Another dentist will choose to do direct pulp capping. Another dentist will choose to do partial pulpotomy or complete pulpotomy. Another dentist will choose to do a root canal treatment. So clinical problems in the field need answer. So in order to answer this clinical problem, we should formulate a question. The question of the clinical problem should follow a specific tool called PICO or PICO, which refer to population, intervention, comparison, and outcome. So population refer to the type or sort of subjects or sample included in the research. Who they are, what are their characteristics, this should be mentioned in the research question. And also there should be mentioning of the type of intervention. What is the intervention we intend to do to compare it? And also the comparison should be mentioned. Compare intervention to what? What is the control that we compare against it? And also we should mention the outcome. What is the outcome that we expect? What is, how we can measure it? So these standards of the research question should be followed. And then we move on to the next step, which is search or finding the evidence. As we say, systematic reviews, used the available evidence from a randomized controlled clinical trial. Therefore, we need to search for these studies and finding the evidence. And then we move on to the appraisal process, or appraising these findings or evidences and performing the critical appraisal process, and then decide the conclusion and evaluate the evidence that we get it from these studies. So PICA tools used to assess the hypothesis or the research question of the study, and also can act as a guide to formulate the question of the study. Systematic review process can pass through these steps. First of all, defining the question. It is similar to the critical appraisal process in general. So, by the way, systematic reviews can be critically appraised as well, as I will show later. Define the question, and then search and review the literature, and then select the relevant studies. There may be some selection bias in this step. And then assess the quality of the studies and assess the outcome by doing a meta-analysis, by collecting all the data from the selected studies and doing a meta-analysis, and then interpret the results. How we can do critical appraisal? What are the instruments we use? Critical appraisal checklists help to appraise the quality of the study design for quantitative studies and qualitative studies as well, the risk of bias. To critically appraise a journal article, you would have to start by assessing the research method used in the study. This is done using a checklist, which are specific to the study design. We have different study design. We have randomized controlled clinical trial. We have prospective and retrospective cohort studies. We have case controlled studies. Of course, there is difference between trials and studies. Trials, there is an intervention, while cohort studies or case controlled or cross-sectional, they call studies, not called the trials, because there is no intervention by the investigator, while randomized controlled clinical trial or non-randomized controlled clinical trials, they call it trials because there is an intervention. So the following checklists are commonly used. First of all, we have critical appraisal skill program, or what called CASP. We have Cochrane risk of bias tool used for systematic reviews and randomized controlled clinical trial. And we have other types of checklists that we can use it to assess or critically appraise a piece of research. From the website of CASP, we have the CASP checklists, which are made or designed to different types of studies. For example, we have CASP checklist for randomized controlled clinical trials, and we have CASP checklist for systematic reviews, and we have CASP checklist for qualitative studies, and we have CASP checklist for cohort studies, and for diagnostic studies, and for case control studies. So there are different types of checklists according to the type of the study we want to critically appraise. So the critical appraisal process is made of 3 components, very important components, which are the validity, the trustworthiness of the results, and the value and the relevance of the research. By the way, I just want to mention that the time may be off after 40 minutes, so you are free to join again with the same link. For validity, the meaning of validity refers to the soundness or rigor of a particular study and extend to the conclusions of the research, if they are true within a particular context, which is known as the internal validity. If the design of the study is valid and the method is valid and the procedure is valid, we will get less biased results. It's very important to exclude or reduce the risk of bias in the studies. and give a more reliable generalized conclusions. What is the bias? The bias is a systematic error in the design or method or procedure that may cause the difference between the groups. This difference is not caused by the intervention or the exposure. Example for this, the presence of confounding factor affected the outcome. For example, we have two groups of subjects, and we have one group with intervention and the other group without an intervention. So if there is a systematic error in the design or the method or the procedure, in case for example, selection of the patient was not systematically approached, and there's a difference between the subjects in this group from the subject in this group, which is not appearing to the investigator. This confounding factor may affect the outcome of the two groups later and will give a biased result. For example, improper randomization of samples in the clinical trial. This will lead to not similar samples. Example, tooth type may be different from one group to the other. If we have molars in one group, more molars compared to premolars, for example, in one group from the other, this may affect the result. If we have a cavity size, for example, one-walled cavity size or two-wall or three-wall cavity size, which is different from one group to the other, this may affect the results. These are called confounding factors that should be addressed during designing the study or during implementing or doing the method or the procedure of allocation or randomization. So invalid design or method or procedure may increase the risk of bias. The bias usually overestimate the result, will not give an accurate result, and will not reflect the real situation, will not reflect the relation, which is the cause and effect. When we do randomized controlled clinical trial, we look for a relationship between the cause and the effect. So if we have bias, we will lose this relationship between the cause and the effect. There will be other factors that affected the outcome, which called confounding factors. So the question to be asked include, to assess the validity of the research, is there a clear statement of aim? By the way, these are should be done in the journal clubs of PhD students or master students. So each student should ask this question or follow the list. It's much easier to follow the checklist. I'll show it to you in a few moments. So the questions to be asked include, is there a clear statement of the aims in this study, which can judge or affect the type of the design? So according to the aim, we will select the appropriate design. The aim should include specify the population of interest, specify the intervention, and specify the outcome. The second point we should ask about it, is there appropriate method to answer the research question? Where the method appropriate to answer the research question, example, randomized controlled clinical trials for interventions. According to the question, we will choose the right method. The third one is there appropriate relevant participant selection, which related to the procedure in terms of recruitments of the patients or randomization of the patients, inclusion and exclusion criteria. All these will ensure that we follow a correct procedure, which will increase the validity of the research at the end. Here you can see apart from CASP checklist for randomized controlled clinical trial. You see in section A, which is the basic study design, whether it's valid for randomized controlled clinical trial or not. The first question, Did the study address a clearly focused research question? Sure, research question is very important, which is the main part. As you can see here, they follow the PICO formula or tool to formulate the research question. So the person, when they critically appraise a study, they look for these points. If the research question contains these, then he will answer yes or no or can't tell. Was the assignment of participants to the intervention randomized? Is very important, which is considered one of the procedure. And this will reduce the risk of selection bias. We have two bias. We have selection bias, we have detection bias. Selection bias is by creating an inclusion and exclusion criteria that should be applied to all participants. And also detection bias, that when we do allocation sequence, which meaning randomizing the allocation of patient using a sequence generated by computer, this sequence or allocation sequence should be concealed from investigator and participants. The investigator and participants should not know to which arm they are included. For example, participants, if they know that they are included in the experimental arm, this will affect their behavior and may affect the outcome. Similarly, for the investigator who assess the outcome should not know this participants belonging to which arm. And the third question, were all participants who entered the study accounted for at its conclusion? Meaning the analysis of follow-up outcome should have the intention to treat analysis. Meaning if we have a dropout or loss to follow-up of patients, then we need to perform intention to treat analysis. All these questions should be asked and answered in order to assess the validity of a specific study. The second part is dealing with the methodology of the study. And we should ask this question: were the participants blind to intervention they were given? Were the investigator blind to the intervention they were giving to participants? And were the people assessing or analyzing the outcomes are blind? So all these parties, the participants, investigators, and assessor, should be blind to the randomization, or should be blind to the intervention they were giving to participants. Were the study groups similar at the start of randomized controlled clinical trial? In that case, we're looking for a table that describing the demographic characteristic of all participants in terms of sex, age, and other variables, in order to assess whether this study recruited similar groups or similar subjects in the two-arm groups. The second part of critical appraisal is to assess the trustworthiness of the results. How the results have been presented in the published research. We need to assess the following. Results, there are different types of results. There are descriptive results, there are inferential results, there are text, tables, and graphs. For descriptive results, we see the tables and figures that describe the subjects or describe the results of the study. Inferential results used to compare the groups of the study. And there are some results mentioned in the text, some results mentioned in the table and graphs, and vice versa. Also, we should look for the precision of the results, whether these results are precise or not. How we can tell that these results are precise or not? We look for the confidence interval for categorical variables, and we look for standard deviation for continuous variables. And also we look for data analysis performed appropriately. What the question to be asked include Is there a clear statement of finding or results? And were the finding justified? Usually in the conclusion. Precision in results. Assess the accuracy and precision of result by looking at p-values and confidence interval or standard deviation. Rigorous data analysis is very important, meaning appropriate statistical analysis selection depending on the data type and the study design, according to a pre-specified protocol. The data are either qualitative, quantitative, observational, and interventional. This will affect the selection of the statistical analysis method. In that case, we will need advice from a statistician in order to ensure that our protocol and our study is well designed and well appropriately analyze the data. So section C will deal with the results, and there are different questions related to the results. Was a power calculation undertaken? What outcomes were measured and were they clearly specified? How were the results expressed for binary outcome? So all these questions will assess whether the effects of intervention are reported comprehensively. Also, the second part was the precision of the estimate of intervention or treatment effect reported, meaning the confidence interval, which is the precision of the result. Do the benefits of experimental intervention outweigh the harm and cost? This is an extra question about if there is a cost and effectiveness analysis for the results, or if there is harm or unintended effect reported for each study group. The third part of critical appraisal is the value and relevance. This is to determine the practical relevance of a research finding within a practical context. We look for the following. First of all, relevance, outcomes, and local applications. So the question will be, is there a practical relevance of finding? Can they be applied beyond the research or just for the research and we cannot apply it? Were any benefits worth harm and cost? Is it harming or is there any benefits from them? Defined outcomes, is there any defined outcomes and how they are measured? Are they important to researcher or patient? So this is called a researcher-oriented outcome or a patient-oriented outcome. For example, we have a patient with a surviving tooth after root canal treatment. He has a periapical lesion, but the tooth is asymptomatic and the tooth is functioning in the patient mouth. From patient perspective, this is enough and there is no problem for the patient. So this is called a patient-oriented outcome. But for the researcher, for specialists like us, there is a periapical problem. There is a periapical lesion and there is a problem. There is a shift from biology or shift from health. So we should balance this outcome, whether it's researcher-oriented or patient-oriented. Also, we should assess if there is an ability to apply findings locally. For example, the country of the study, what sort of participants in the study, what are the type of intervention, and what are the clinical regulation in that country, and whether this outcome that we found in the study, is it applicable in that country or in that society or in that population? So these are the questions related with the application or applicability of results in a specific context. Can the result be applied to your local population in your context? Would the experiment intervention provide greater value to people in your care than any of the existing intervention? So you have existing intervention, but you found another intervention in the study. Is it greater value for you? So this question should be answered in order to critically appraise a piece of evidence. So method selection will control the precision and the validity and value and relevance of a specific study. It's very important to formulate a good hypothesis and selecting the appropriate design and performing the method precisely and reporting the results. All this will increase the validity and value and relevance of the study. For example, we have here a systematic review, which is the diagnosis of condition of dental pulp, a systematic review. As you can see here, this systematic review was to appraise the diagnostic accuracy of signs, symptoms, and tests used to determine the condition of the pulp in teeth affected by deep caries, trauma, or other types of injuries. You can see the research question is very clear. You have population, you have intervention, and you have comparison. Of course, this is for diagnostic studies. This is different. It's not like randomized controlled clinical trials. For intervention, it's for diagnostic studies. There are different types of studies. So a critical appraisal of different type of studies need a different question form. The method of them, they use literature search in the database from this time to this time, and they found their results that there was 18 studies fulfilled pre-specified inclusion criteria. How they assess the quality of included articles? This was assessed by QUADAS, which is a tool designed by Bristol University, University of Bristol, to assess the quality for diagnostic accuracy studies, because the design is different from one study to the other. So each design needs specific tools to assess its quality. As you can see, they identify 18 studies that fulfilled pre-specified inclusion criteria. By the way, in the systematic reviews, there may be also a selection bias for the studies. So there is also a checklist for the assessment of systematic reviews to assess and critically appraise systematic reviews. The quality of included articles was assessed using QUADAS tool, and based on the studies of high and moderate quality, the quality of evidence of each diagnostic method or test was rated in 4 levels according to grade. See, they use another tool, which is great, to assess the evidence released from these studies. Their conclusion, there was no study reach high quality. 2 were of moderate quality. The overall evidence was insufficient to assess the value of toothache or abnormal reaction. And by this way, the systematic reviews can reach to a clinical guidance. So this can be considered a clinical decision-making that can help the clinician in their work. I like this statement by Miles Kington. I found it in the YouTube. It says that knowledge is knowing that a tomato is a fruit, but the wisdom is not putting it in a fruit salad. So not every piece of research is valuable. There are a lot of research that have a shortcoming or bias in its results, and we should critically appraise each piece of research and not take it as a fact. There should be some stop and looking for the elements of the research: validity, trustworthiness of the results, and the value and relevance. So what are the features of well-planned and executed scientific study? First of all, there should be a good research question, specific purpose of the study and hypothesis, appropriate measurements to test the hypothesis, subjects are representative of population under investigation, inclusion of appropriate controls, sufficient study size and power, appropriate randomization of treatment allocation, and controlling for confounding factor, a blind experiment, and use of current statistical method for analysis. So the research question and hypothesis. How we can consider this research question is a good research question. First of all, the research question should identify the gap in knowledge through literature review. Also, it should be formulated to address such gaps directly. The research question should address a problem of importance to the patient and clinician, and the question should be specific. Ideally, only one question to be addressed in each study, but you can add another outcomes or another question that address other outcomes or secondary outcomes. How you find the research question, or in other words, the aim of the study, what they are aiming to, how they answer this question. You will find it at the end of the introduction section of an article. Sometimes you will find secondary questions or outcomes. How you can assess the research question, as we have mentioned before, PICO format is used to assess the research questions, and also can be used to formulate hypotheses in clinical trials. So the research question should include patients or population. Who are they? For example, I'm working on patients. I should specify that they are patients with reversible pulpitis, patient presenting with signs and symptoms of reversible pulpitis. This should be specified in the hypothesis. Second thing is to mention the intervention, or can be E, not I, can be E for exposure. You know, cohort studies, sometimes they don't use intervention. They don't study the intervention. They study the exposure of the person, for example, for a diet, for a lifestyle. So this called exposure. So either it's PICO or PICO. What is the type of intervention should be mentioned in the hypothesis? C, comparison. Compared to what? Compare the experimental intervention to what? To control intervention, for example. What is this control intervention? And also the outcome. What is the outcome or outcomes? Okay, so these are the parameters that should be used to formulate a research question or hypothesis. Example of specific research question. Would the presence of Enterococcus faecalis in the primary root canal infection result in persistent periapical disease following treatment? Good hypothesis should be testable and be simple and be specific as well, and should involve measurement, qualitative or quantitative form, and should possess generality. If you put a hypothesis that is not testable, you can't test it. If it was complex, you will lose your way in the process of the research. If it was not specific, you will not know what you are looking for. And should involve measurement, how you can measure this hypothesis. So these are the points that need to characterize the hypothesis of the research. An hypothesis is referred to the working hypothesis, but usually state in its negative form or null hypothesis. For example, if the working hypothesis is the presence of E. faecalis preoperatively is significantly associated with lower chance of success in a primary root canal treatment on teeth with periapical pathosis, then you should state the null hypothesis as the presence of E. faecalis preoperatively has no effect on the chance of success. And by doing your method and acquiring your results, you can judge or you can know that either reject the hypothesis or accept this hypothesis. So the hypothesis should be null in the middle of the middle of the scale. Either you reject it or you approve it. This is something related with the statistics as well. If you see the statistics, there are two-tailed statistics and there is one-tailed statistics. So by putting the null hypothesis, you can reject it or accept it. So presence of E. faecalis preoperatively has no effect on the chance of success. And then you have the mission to prove that or reject that. And the primary root canal treatments on teeth with periapical pathosis. Example of ambiguous hypothesis. For example, warm vertical compaction technique is more effective than cold lateral compaction technique for canal obturation of anterior teeth, but not molar teeth. You can see there's two hypotheses in this study, and the effectiveness should be replaced with more specific term. It's not specific, it's general. What meaning of effective? How you can measure effective term here? So effectiveness should be replaced with more specific term, and the test condition should be also specified, example, clinically or in simulated in vitro model. You don't know the situation, is it in vitro or in a clinical? That should be specified in the hypothesis question or research question. What is the study design used to answer the question? This is very important. How we can answer the question. So if you can see here, best study depend on the question of the study. So you choose the study design according to the question. So randomized controlled clinical trials, it is the gold standard evidence because they establish a cause and effect relationship. If you don't want to know, or you don't want to establish a cause and effect relationship, you can follow other designs, which are the control trial, prospective cohort studies, retrospective, case control, cross-section studies, or in vitro studies. Appropriate measurement to test the hypothesis. The measurements should be valid. Example, to assess the periapical healing following root canal treatment, we have different measurements that we can use to assess this outcome, which is the periapical healing following root canal treatment. We have direct measure, which called the histological examination, which is the gold standard, and for ethical reason, we cannot do it on patients. But it is the direct measure and the gold standard measure. We have a valid surrogate measure, which is the radiographic examination for periapical radiolucency, which is a validated outcome or validated measure, validated measure. Because there are some studies that assessed the radiograph examination and the histological examination, and they found a correlation between them. Therefore, it is a validated measure and can be considered as a valid measurement of periapical healing following root canal treatment. And then we have invalid surrogate measure, like clinical symptoms. They are invalid and they cannot be used to assess the periapical healing following root canal treatment. This is an example of valid measurements to test the hypothesis. The measurement also should be accurate. Example, to assess the periapical healing following root canal treatment. We have good quality periapical radiograph image, but we can be more accurate and use assess periapical radiographic image under magnification and blocking of extraneous light. This will give more accuracy to the measurement, or we can use CBCT measurements, which is more accurate than previous measurements. The measurement should be repeatable. Example, to assess the periapical healing following root canal treatment, we should do a pre-calibration to improve repeatability, meaning that the assessor of the periapical radiographs or the CBCT, they should underwent a pre-calibration session by giving them other images of periapical lesion, periapical radiograph and CBCT different from the sets of the experiments and calibrate them to assess the periapical healing. And also by repeating the measurements, we can get a repeatable measurements, repeating the measurement after 1 month, and then we do agreement test between the first measurements and the second measurements and see if there is an agreement between the observer or even within the observer. They call it intra-observer agreement or inter-observer agreement. For some laboratory experiments, the way of repeating the measurement is by running the experiment in duplicate or triplicate, or even repeat the experiment in another occasion. Sample population under study. I will give you example of bias sample, how we can be biased by selection bias. They call it selection bias. And also we have detection bias. I explained in the beginning. Selection bias is a bias in the selection of sample. You don't have similar samples in the both groups. There is a selection bias. And we have detection bias when you assess the outcome of the subjects, you see that there is a bias in the detection. Example of bias sample to investigate the prevalence of periapical disease amongst the general population. General population, you should notice that it's in general population in the city. So you going to patients attending for root canal treatment, a specialized hospital were selected. This is a bias selection because you are going to a specialized hospital and for patient attending for root canal treatment, so they already have a periapical problem. You should go for a general population in order to answer this question. Otherwise, you should change this question and put it as the following: to investigate the prevalence of periapical disease in patient attending for root canal treatment at a specialist hospital. And by this way, you prevent the bias in the sample selection. The second example is to investigate the prevalence of pain following root canal preparation in teeth with periapical disease. In that case, you just included only patient with no preoperative pain were included, which is a biased sample selection, because you included only the patient with no preoperative pain. So appropriate randomization reduces the risk of selection bias. I will give you an example of how you can do appropriate randomization to reduce the risk of selection bias. Let me share with you another screen, please. So here it's my my paper in the Journal of Dental Research, which was a randomized control clinical trial during my PhD study. If you can see here, at the material method, you see a section called the study design and patient recruitment and randomization. So this single blind, this will determine whether the patients and the operator are blind. So because we are doing intervention, therefore it was difficult for the investigator to be blind. So only the patient was blind. So we call it single blind. Two arm, meaning two groups. Parallel group mean they are followed for the same period of follow-up. Approval, research ethical approval, and then I will talk about the power of the calculation later. And we come to the randomization. Okay. Patient information sheet were distributed and informed written consent was obtained prior to study commencement. And then we perform a block randomization was performed centrally by the biostatistics units. So not me who do the randomization, but the biostatistics units in order to prevent selection bias. at King's College London with the tooth as the unit of randomization, not the patient, and the samples were stratified. I will talk about stratification, how we can prevent the effect of confounding factor. In that case was the cavity size, whether it's 1 or 2. So in order to ensure that equal amounts or equal numbers of cavities with 1 wall or 2 walls or more than 2 walls are appropriately or equally distributed in the 2 arms of the study, we perform stratified randomization, which is type of the randomization. This factor was considered as a prognostic factor or a confounding factor that could affect the outcome, not the intervention by itself. Therefore, we should account for it by doing stratified randomization to be balanced during concealing allocation. Allocation should be concealed from the investigator and from the patient and from the assessor by using a random number generator or computer random number generator. And the allocation concealment was performed using a central telephone system. Okay, we move on to our slide. Oops, sorry, just a minute. Okay. So as we say that appropriate randomization reduces the risk of selection bias. Also, we should choose appropriate controls. What is the control? It's a similar group of study units which will not be exposed to the test variable. Why do we need a control? First of all, to eliminate bias in the results. Second, to record what would have happened without the intervention of the test variable. So the control are very important in the good design study. To assess the proportion of teeth, for example, to assess the proportion of teeth with absence of bacteria recovered from root canal following chemomechanical canal debridement. In that case, we don't need a control because the control is within subject. No control group is required for this within subject study since the teeth can act as their own control, which is the preoperative canal sample. Another sample to evaluate the effect of irrigation with 2% chlorhexidine solution during chemomechanical canal preparation on the quantity of residual bacteria recovered from following treatments. Controls should be a similar group of teeth subjected to the same mechanical canal preparation, but either without no irrigation was carried out or using a solution with no antibacterial property. So in that scenario, in order to answer the question of the research question, we need another set of teeth in similar group in order to answer this question, which is whether 2% chlorhexidine during chemomechanical canal preparation on the can affect the quantity of residual bacteria recovered following treatment. So according to scenario, according to the question, we will design our study. Sufficient study size and power. What is the power of a study? It is the probability that a study of a given size would detect a real difference of given magnitude as statistically significant. Why do we need sufficient size? Small study size would fail to detect any real difference between the two groups. Small study size may yield a statistically significant result only if by chance that the observed difference in the sample is much larger than the real difference. How to estimate study size? First of all, we should determine the power of the study. If the power of the study is set at 80%, then there are only 80% chance for the study to detect a real difference. Usually studies set their power at 80, sometimes 90, but if you increase the power, you need to increase the study size. Also, we should set the significance level. For example, P equal to 0.05, meaning that only 5% chance that a difference is detected when there is no true difference. If you decrease the p-value or the level of significance to 0.01, you will need bigger study size to detect the difference between the two arms. How to estimate study size, the expected outcome in each group based on previous data. So if you have a previous data that tell you that there is a difference or expected difference between the two arms or between the two groups will be equal to, for example, 20% or 30%. Then you can estimate the study size you needed. This should be done with the help of your supervisor in order to assess what is the expected outcome in each group. For example, in studies that dealing with categorical data, you need to expect the proportion of teeth with a positive outcome in each group. For example, I expect in my study that one group will give me a success rate of vitality or pulp survival of about 70% after 1 year. And I expect the other arm or the other group will give me 90%. Let's say, so the difference I expect it to be at 20%. This is for categorical data, and for continuous data, you should look for expected standard deviation of the outcome measurements in each group and the expected relevant difference between the two groups. In this situation, you need to, it's recommended to seek a statistical advice. Appropriate randomization of treatment allocation. Why is random allocation is important? First of all, to eliminate bias in selection in the way a treatment or test control are allocated to patient and teeth. Also, to ensure characteristics of the test and control groups are similar, as we have explained before, and to eliminate any difference between the two groups that may affect their response to treatment. Randomization can be one of these one of these types, either simple randomization, there is no restriction on the allocation, and there is different numbers of subjects in each group. And we have a block randomization. In that case, groups are equally sized between the two blocks. And we have stratified randomization, meaning that the characteristics are equally distributed between the two groups. For example, male and female are equal in each group, or as we have explained before, the cavity size, the age of the patient are equally distributed in each group. How we can control for confounding factor, as I explained before, that subjects are different and there may be a hidden confounding factor. For example, we have this relation between male patients and lower success rate of root canal treatments. The real prognostic factor for the lower success rate of root canal treatments is a preoperative periapical lesion, which is considered as a confounder. And there is a real association between male patient and preoperative periapical lesion. Therefore, the relation between male patient and lower success rate of RCT is a pseudo association because there is a confounding factor that should be accounted for during our design or analysis. Also, in this example, we have asbestos smoking worker. There is a pseudo association with lung cancer because lung cancer can not just be from smoking, but it is from asbestos exposure, which can be considered as a confounder. as a true prognostic factor, and there is association between asbestos smoking worker and the asbestos exposure. How to control confounding factor? Before experimental work, we should have restriction, matching, and random allocation. After experimental work, we should perform our analysis in a stratified analysis or use of multiple regression analysis. Statistical support is required during protocol development and data analysis. Observation bias and systematic errors can be eliminated by blind experiments. This is called detection bias. If there is a detection bias, meaning that the observer or the assessor of the outcome have a knowledge about the experiment, about the intervention, and whether this participant is belonging to the intervention, experimental intervention, or the control intervention, which will affect the results. So in order to eliminate observation bias, we should follow a blind experiment. By running the experiment in a random sequence of test and control units, and observation are made in a random sequence of test and control units, and observer are unaware of the test and the control units. For clinical trials, double blinding is usually required, meaning that the subject and observer are unaware of the treatment, whether it's test or control. In case of surgical procedure, for example, root canal treatment, under investigation, the observer should not be the clinician providing the treatment and should be blinded from the interventions and the control, and only should assess the outcome without knowing or without be aware about the intervention and the controls. Single or double blind. For single blind, meaning that one party is blinded to the allocation, for example, the patients, may still introduce bias if one party is aware of the treatment allocation. For double blinding, there are two parties blinded to the treatment allocation. Behavior and subjective belief are less likely to influence outcome as well as in the single blinded randomized controlled clinical trial. Also, we should consider the correct statistical method should be implemented. Example of common problems. First of all, applying the methods of analysis of which the assumptions were not made by the data, or using multiple comparison instead of an analysis that consider all groups, meaning that using multiple regression is much better than using multiple statistical comparison tests that compare different groups each time, ignoring the pairing nature of paired data. Some data may be assessed or evaluated or measured at 2 times, the same sample measured 2 times. This is called paired data, and we should not ignoring this by using the appropriate test that measuring these paired nature. Failing to account for confounding may result in a problem in the statistical analysis. Failing to account for clustering effect of multiple observation on the same subject. Sometimes we have patients that have 2 or 3 teeth, and this will create an effect called the clustering effect that should be accounted for during our analysis or statistical analysis. So in conclusion, we can conclude that the main features of a well-planned and executed scientific study are, first of all, a meaningful and specific research question, a well-prepared research protocol. The design should aim to reduce errors, either systematic or random, and the protocol should be strictly adhered during experimentation. Thank you for kind attention. If you have a question, please raise your hand. I will I will paste the link for registration right now. Just give me a moment. Sorry. Just one moment. Just one moment. I will give you the link for registration. I have pasted the link for registration in the chat. You can register for this seminar. Please, if one have a question, he can raise his hand so I can. Dr. Enes, I will unmute you. Please bear with me. Okay, Dr. Enes.
Thank you, Dr. Ahmed.
Thank you very much.
Thank you for your nice presentation and all this valuable information.
Thank you very much.
If anyone have a question, please just raise your hand. Actually, I have a question.
Yes, please.
For you, Dr. Ahmed.
Yes.
It's about our researcher, our new researcher now, the PhD and the MSc students.
Yeah.
What's your advice for them in their work in the literature review, which is one part of their requirements? So if you, for example, give them some handout for how to criticize papers when they are doing some selection for papers for the literature review and how they can gather information. Actually, it's a big subject for them. I think it's a very scientific lecture, and maybe they have been have some shock. But I think it's also targeting our member staffs. So thank you very much for all this valuable information. If we can please answer my question about them.
Yeah. Thank you for your question. Well, a literature review, it's another subject. In fact, it can be correlated with a critical appraisal, but critical appraisal process is a process that used to tailor the evidence of clinical trials. But literature review is another thing and should follow the critical appraisal process, meaning that you find a clinical problem or a situation or a subject, and then you look for the research question or what is the question you are looking to answer it, and then you should search for the available literature. It's a similar process for a percentage. So you look for the literature available, and then you start to evaluate this research, not just by copy and paste what you have found, but you should answer, you should critically appraise these findings. Not every paper or research have a valuable information. So you should look for the peer-reviewed peer-reviewed articles, and you should assess them in the way that we have explained just in our seminar. You should look for the research question. You should look for the methodology. Is there any problem in the methodology? By the way, this is very helpful for them to find their subject and their interest by looking for the literature available and what are the gaps in the literature that they can answer it during their research journey in the master degree or the PhD study. So looking for literature is very important for them. Critical appraisal can play a small part in their analysis for research in their literature review project. I hope to answer this question, but it's a big subject about the literature review.
Yeah, hopefully we can manage to arrange another seminar or some workshop for them about the literature review and how to arrange.
Yeah, because literature review is a narrative process. It's like like telling a story. You can put your input, your analysis, but to a limited degree. But in a critical appraisal process is different because you should weigh the evidence that you have it from clinical trials or from studies and project it to the population or the communities with a clinical making decision. So it's little different from literature review. Literature review is like a narrative process.
Yeah, also there is a systematic review, which is like much more detailed. How to tell the story in much more ordered way or scientific way, and how to gather the information and how to make them non-biased also in selecting the information, as you tell also in your lecture. Thank you, Dr. Ahmed.
Thank you, Dr.
And if there is any question for
yes, everyone who need to have a question, please raise your hand so I can unmute you.
Yeah.
I believe everyone have got the link. The link for the registration. Yes. Yeah.
Thank you very much.
Thank you, Dr. Thank you for everyone for attending this seminar, and we hope to meet you again in next seminars and next workshops. And have a good night. Thank you very much. Cheers.
Thank you, Dr. Ahmed. Thank you. Bye.
Bye.